Hey y'all, we are going to go over the gross anatomy of different lymphoid organs. So where do we find lymph organs all over the body, and what is their general role? Let's start with bone marrow. Red bone marrow, which I actually don't have here, red bone marrow would be found in the proximal epiphyses of long bones, so like the femur or any other long bone. That's where you could find red bone marrow. So that's a primary lymphoid organ. Another primary lymphoid organ is the thymus. And the thymus is actually more prominent in children. So here's a model of a child. The thymus sits right on top of the heart. Highlighted here in pink is the thymus. Here's the heart. The thymus is where T lymphocytes mature. B lymphocytes mature in the bone marrow, and that's where all the other blood cells are made. T lymphocytes are originally born in the bone marrow, but they mature here in the thymus. Differentiate the thymus from the thyroid. The thyroid is an endocrine gland. It's superior to the thymus. The thyroid is by the trachea and larynx. The thymus is superior to the heart, but inferior to the thyroid. That's the thymus. So both the thymus and red bone marrow are primary lymphoid organs. Secondary lymphoid organs are organs where the lymph gets filtered. Lymph itself is runoff fluid from the circulatory system, and so these other places are where the lymphocytes and other blood cells can get experience, so to speak, in fighting off different types of infections. So let's remove some of these organs here so you can see it better. Removing the lung, here's the liver, here's the stomach. Oh, there goes part of the large intestines. All right, so we're looking at retroperitoneally. All these organs that we removed, like the liver and the stomach, they're peritoneal organs. This is within the abdominal cavity, but it's retroperitoneal. So you can see the adrenal gland and the kidneys. This is the spleen. Here's the pancreas. That's an endocrine/digestive gland. This is the spleen. The spleen is the spleen is a lymphatic organ. The spleen is important for destroying old red blood cells, and that's what the red pulp is for, where you find macrophages. But there's also white pulp for filtering pathogens that might be found in the lymph fluid. This blood vessel right here, this is the splenic artery. Coming back in blue, that's a splenic vein. Splenic artery branches from the celiac trunk. That's what this branching point is here. And it's a little bit off. But yeah, here's the celiac trunk. Here's the splenic artery. Splenic vein goes to the inferior vena cava, which I can actually show you a little more clearly here. Inferior vena cava. All right, so that's the spleen. Another lymphoid organ. Let's look at the tonsils. So the tonsils can best be seen, obviously, with a head. There's no head on this one. There are 4 different types of tonsils, but there's actually a total of 7. The first tonsil, here's the nasal cavity, here's the concha. It's posterior to that. This is the pharyngeal tonsil, also known as the adenoid, but I'm going to call it the pharyngeal tonsil because this is the beginning of the pharynx. Pharyngeal tonsil. We need tonsils because we're breathing things in or ingesting things, and that means we're taking things from the outside, and who knows what kind of pathogens we might be getting. So tonsils are a line of defense against that. They can get infected sometimes, and that's why people get their tonsils removed, kind of like your appendix. But if they are functional, then they are helpful. Pharyngeal tonsil, you only have one of them, and it's the biggest. See this hole right here? This hole is your auditory tube. It goes to your ear. Your ear is connected to your throat. Your ear is connected to your throat. That's the auditory tube. Surrounding that is the tubal tonsil, and you have 2 of those, one on either side. So you have a tubal tonsil, pharyngeal tonsil. This is the hard palate and the soft palate. This is the maxillary bone. This is the palatine. This is the palatine bone. So towards the palatine bone, over here in the pharynx and the throat, that is the palatine tonsil. You have two of those. When you open up your throat, you can see them on either side. Palatine tonsil right here. And then over here, this is the tongue, and just posterior, inferior to the tongue, this is the lingual tonsil. There are two of those. One large pharyngeal, two tubal, two palatine, and two lingual tonsils. Those are your tonsils. Lining all of your tracts, all of your tracts that have mucous membrane, so your respiratory tract, your digestive tract, your urinary tract, your reproductive tracts, all your tracts are exposed to the outside, so they need further protection. So we had tonsils here. For all the other places, we can generalize and call them mucosa-associated lymphoid tissue. You have lymphoid tissue in the submucosa. It's deep to the mucous membrane, deep to the mucosa. One example of that mucosa-associated lymphoid tissue where you can find it is in the appendix. Here's the, actually let me back up. Before we get to the appendix, when you digest food, it goes from the stomach, through the stomach to the duodenum, duodenum to the jejunum, and then the last part, which it's hard to point out because it's all convoluted. The last part of the small intestines is the ileum. So here, this little part here, this is showing the ileum. And let me pull this off so you can see it better. Yeah. So this last part is the ileum. And in the ileum, we have Peyer's patches. Just deep to all these plicae, these folds, in the submucosa, there are Peyer's patches. Take a look at the histology video for that. So you have Peyer's patches, which are a type of malt in the ileum, I-L-E-U-M. Then when we get to the large intestines, you can see here's transition from small to large intestines. This is the ileocecal valve into the cecum. Where did that piece go? Here it is. When we make that transition from small to large intestines, we get to the cecum, but there's this little thing hanging off of the cecum. See this little extension right here? It's better seen from the back side of this model. This little finger-like extension is the vermiform appendix. The vermiform appendix. I got mine out, one of the worst pains in my life to get that infected. But when it's not infected, it can serve as a useful lymphoid tissue. That is the vermiform appendix. Vermiform means worm-like. You can just call it appendix, because that's what most people call it. The vermiform appendix. You also have lymph nodes, and lymph nodes can be found all over the body. But on this model, we can only see them here in this groin region. These are inguinal or iliac lymph nodes. We have lymph nodes everywhere, though. They tend to cluster in major joint areas. So you have lots of cervical lymph nodes, which is, when you go to the doctor, they feel your neck. They're feeling for the cervical lymph nodes. You have axillary lymph nodes in your armpits, iliac and inguinal lymph nodes, and also, again, lymph nodes all over the body. But those are some of the major ones, huge clusters of them found in the cervical region, axillary region, and inguinal iliac region. A few more things I'd like to show. This model is showing a blown up version of the duodenum, pancreas, and spleen. Duodenum, pancreas, and spleen. The spleen is only next to the pancreas. It's not connected functionally to the pancreas. It just it happens to be right here. The spleen looks a lot like a kidney. They're not the same thing. This is the spleen. The kidney would be over here. Just so you can see that in relation. Here's the spleen. The kidney's over here. Duodenum, pancreas, spleen. Duodenum, pancreas, spleen. And here we have a blown up version of a lymph node. This is a blown up version of a lymph node. A lymph node has, like many of these other lymphoid organs, have lymphoid follicles. That's what these round things are. And at the center of these lymphoid follicles, you can find germinal centers. This is where more lymphocytes can undergo mitosis and reproduce, make more lymphocytes help fight off an infection, which is why your lymph nodes would grow if you are infected. These little extensions into the lymph node, those are called trabeculae, branches. And these spaces are sinuses so that you can deliver lymph. That's what these vessels are. You can deliver lymph into the lymph node and have that fluid filtered by the lymphocytes that are found in the follicles and in the sinuses. Note that these lymph vessels have valves, and they're pointed in a certain direction. So this valve is meant for fluid to go into the lymph node, whereas this valve is meant for fluid to exit the lymph node. Lymph nodes also tend to have one region where major blood vessels go in and out. This region is called the hilum. And so here it's kind of pinched in at this part. Everywhere else it's just kind of got this bulging, roundish texture. But you've got lymph vessels for delivering lymph fluid into the lymph node, and then a major one going out. All right, those are all the lymph organs that I would like you to know. There's of course more than that, but we don't have time. I think this is enough. Thank you for watching. Please let me know if you have any questions. Take care.